AI is showing a tremendous amount of hope and promise. Nurses are the ones closest to healthcare delivery. CA Healthcare is piloting nurse handoff in 5 of its hospitals. This is the direct involvement of frontline nurses in the app development. Hello, everyone. Welcome back to Unlocking the AI Advantage podcast. And this is your host, Ramesh Danta. We've been diving deep into how AI is revolutionizing various sectors. And in our recent episodes, we have really zeroed in on healthcare, where AI is showing a tremendous amount of hope and promise, especially on the operational and non-clinical sides. If you're following a podcast, you may have come across a few episodes ago a truly insightful conversation with Rebecca Love, CEO and founder of Nurse Approved, who herself was a practicing nurse and actually is a practicing nurse and a passionate advocate for the nursing profession. That interview, which we recorded live at the Vive 2024 conference, really highlighted some critical issues in nursing. And let me summarize some of those things. Rebecca opened our eyes to what she calls the nursing crisis. She explained that while we have over 5 million nurses in the United States, I'm talking primarily of the United States, making nursing the largest workforce in healthcare, and indeed the largest workforce of any kind in the US, we are facing a significant shortage of nurses willing to work in healthcare environment as they are today. The environment, she emphasized, is destroying the nursing workforce with increased burden, workloads, heavy workloads, and burnout driving nurses out at an alarming rate. She even mentioned that 57%, remember, of all new nursing graduates leave the bedside within 2 years. That's a significant number. This isn't just about a shortage of people, it's about the conditions that are pushing our dedicated nurses away from direct patient care. So Rebecca passionately argued that nurses are the ones closest to healthcare delivery and patients, possessing a deep, invaluable knowledge of what truly works and what doesn't. She lamented in that episode that nurses, despite being experts, are often left out of conversations where critical decisions about healthcare are made. Her hope, a vision we discussed, was that AI could help by taking over many of the administrative tasks that burden nurses, keeping them away from bedside and allowing them to reinvest their time directly with patients. And that is what her vision was. And she shared an example of a nurse using AI to scrub patient data to quickly identify allergies, showcasing how technology can directly save lives by supporting nurses. So she was not fighting AI. She was actually advocating for AI to help with some of the administrative tasks in that episode. Now, following up on that powerful conversation, we have some exciting news that directly address Rebecca's vision. So today I'm going to talk about that innovation. Google Cloud is working with HCA Healthcare on a new AI-powered app called Nurse Handoff. So this episode, I'm going to go a little deep into that particular Nurse Handoff where Google Cloud is working. Designed specifically to tackle the massive amount of paperwork and communication that burden nurses during daily patient handoffs. So let's break down why this is such a big deal and why I believe it's such a big deal. At HCA Healthcare, which is the largest hospital provider in the US by number of hospitals and beds, thousands of nurses spend as much as 10 million hours a year on paperwork and communication. That's a significant amount of time just for their patient handoffs. So imagine that 10 million hours. So these handoffs occur roughly 60,000 times a day across HCA Healthcare's 190 hospitals and 2,400 ambulatory sites. That is 60,000 times a day. So patient handoffs are far from routine paperwork. They are a crucial step to ensuring uninterrupted care, patient safety, and continuity. So nurses pass along carefully collected patient-specific information to the next shift, which is fundamental for them to get organized to the next 12 hours of care approximately. Traditionally, this relies heavily on nurses' recollection of events, conversations, and data leaving room for error and inconsistency. So it's not everything is written down. It is also involvement of the recollection of events and that kind of stuff. So Samantha Hall, a registered nurse at HCA Healthcare Hospital, mentioned that depending on the patients and nurses involved, you could end up with a pretty big stack of papers. So that is the reality in this situation. So this is precisely where the Nurse Handoff app comes in, developed by HCA Healthcare's Digital Transformation and Innovation Department in collaboration with Google Cloud Healthcare Solution. It's designed to collect and organize patient notes digitally, making them easier to reference and more accurate. So the app shows nurses their electronic healthcare records, EHR records, on one side of the screen and the AI generated output on the other. So the AI behind it's powered by Google's MedLM models, right? So that is very specifically focusing on healthcare and focusing on the patient care in this case, which run within the Nurse Handoff app. These models can ingest, analyze, and develop a cohesive and concise view of pertinent patient information for the nurse that's coming after the shift. As nurses use the app throughout the shift, they can easily review, find, and add their own notes to the automated shift report, allowing the systems to keep building relevant patient data from notes, orders, tests, and more. I mean, imagine the situation where you have 3 shifts ago, something happened. That information is not lost in the handoff. Now it's carried over. Okay. And importantly, all of this happens within a highly secure cloud environment to keep patient information confidential. The potential impact on the operational side for this one is enormous. If nurse handoff can even have a small effect, nurses could reclaim some of those 10 million hours, right? So I'm just talking about even a 10% of this, right? So it's a significant amount of savings currently spent on paper-based tasks. So this means more time with patients, increased accuracy. Definitely accuracy will improve in this one because it's recorded and it's being transferred electronically, and potentially new insights from analytics, all leading to better health outcomes. So what's particularly encouraging about this initiative, and sometimes something that Rebecca Love would certainly appreciate, is the direct involvement of frontline nurses in the app's development. So some of the names that were mentioned in this particular application development research that we have done is a registered nurse, Casey DeShalter, on the HCA Healthcare team, became the product owner for Nurse Handoff. Nurses like Samantha Hall were early testers, the beta testers, providing crucial feedback to fine tune the AI model and user experience. So they reviewed the model's output, highlighting what was unnecessary, repetitive, inaccurate, or missing. As Hall recalled from her experience, this iterative process made the app progressively more accurate, a little less filled with fluff, more useful for the handoff setting, right? So we keep hearing some applications where, for lack of a better word, it's a PR than actual operational benefit, but this is not so. This collaborative approach directly aligns with Rebecca's advocacy for nurses to be in the driver's seat, using their voices to design solutions. So there is always that challenge, that fear that AI is going to replace people. But in this case, it's actually working with people, in this case, nurses, helping them out in their daily routine. So currently, HCA Healthcare is piloting nurse handoff in 5 of its hospitals, gathering feedback. So far, the results are very promising. And from what we have seen, and promising nurses testing the tool at one facility rated as 86% factual and 90% helpful. That's the feedback they got. The plan is to eventually to roll out this version for use by 99,000 nurses working across HCA healthcare system. So again, given their scale of being the largest hospital system there, so any success that they have is likely to spread across industry, because people will be looking at how HCA is rolling out. So this particular partnership for the Nurse Handoff Op truly exemplifies the kind of unlocking the AI advantage we often talk about on this podcast. It's a concrete step towards taking Rebecca Love's vision of freeing nurses from administrative burden to put them back in front of the patient care and making it a reality. So it shows how AI isn't about replacing nurses, but about empowering them, making their crucial work more efficient, accurate, ultimately leading to a better patient care and a more sustainable nursing profession. The future of healthcare, as we continue to explore on this podcast, clearly lies in leveraging technology, especially AI, not just for groundbreaking discoveries, but also for optimizing the day-to-day operations. Actually, I would argue that that's where most of the benefit is coming from. These are vital to patient well-being. So again, the voice and expertise of nurses must be central to the transformation for this to work. With that, I just thought this is an exciting development. And then if you have any such other examples, please send them our way. If you want to go back and listen to Rebecca's podcast, it's right there on the website podcast listing that you'll be able to find it. This came right after the Vive conference in 2024, as I said, somewhere in the April timeframe. So again, thank you for joining me on this episode of Unlocking the AI Advantage. We'll continue to bring you insights into how AI is shaping our world, one innovation at a time. Until next time, this is Ramesh Danta. So stay curious. And if you like this episode, or if you're watching it on a YouTube, please like it, share it. And then if you have not yet subscribed, subscribe to the channel. Until next time, bye.